Meanwhile, in Los Angeles, we're getting a first glimpse into what will likely be a lengthy trial seeking to hold the world's biggest social media companies responsible for harms to children on their platforms. Meta and Google face claims their apps deliberately addict children. Yesterday, the head of Instagram, Adam Mosseri, took the stand and claimed, quote, problematic use is not a clinical addiction. I want to bring in Dr. Courtney Blackwell, associate professor in the Department of Medical Social Sciences at the Feinberg School of Medicine at Northwestern University. Courtney, thank you for being with us. We heard the head of Instagram deny that social media, or Instagram specifically, can be clinically addictive. The plaintiff in this case claims she was using the site for many hours a day and it contributed to her mental health issues. What's your definition of clinically addictive?
So it's important to note that there isn't an official clinical diagnosis for social media addiction in the mental health clinical sphere. That doesn't mean that problematic social media use doesn't exist. And so excessive use, always thinking about social media, using social media as a replacement for other things in life, really some of what we would think of as addictive behaviors are definitely showing up in the younger population.
So there are categorically addictive substances out there, like alcohol, for example, and there are physical tests, medical records that can show a direct link between consuming excess amounts of alcohol and various health issues. But nobody's suing the alcohol companies because they become addicted to alcohol. So far, there's no physical evidence of mental health issues. Is that going to be a challenge for these prosecutors to prove in court that these social media companies are directly harming children's mental health?
So I don't have a legal background, so I can't comment on the legality of it. But from the research standpoint and our research, it's inconclusive. There is no conclusive cause and effect of social media causing youth mental health problems. We do know that young children and especially teenagers may be more vulnerable to some of these social media, thinking about likes and getting likes and posting and being a little bit more risky on social media. So we know that, but we don't know that it definitively causes different mental health conditions.
So in your practice, though, do you see how social media is impacting young people's mental health directly, just what you're seeing from the people that you're talking to?
So I'm not a clinical professor, and I don't work directly with young children in a clinical perspective, but I do talk to a lot of children through our surveys, through our research, through our qualitative focus groups and interviews. And if you look at even the data coming out of other places, the youths do say they're online constantly. About 50% say that. So they are using it a lot. And for some youth, it may be that they are using it to replace other things. They're using it as a coping mechanism. And if that's your only coping mechanism, I would argue that then potentially it could result in some difficulties for your mental health and that you might need help finding other ways to cope and other strategies that aren't just social media.
A lot of people are comparing this case to what we saw with big tobacco. If Meta and YouTube lose this case, do you think this is going to be a bellwether moment for not only the social media industry, but really for mental health as a whole, much like we saw with cigarettes?
I do think it has the potential to do that. Grounded in the research, I don't think there's enough out there to support such a huge change if we just look at the research today. But depending on what happens in the trial, I do think it's going to have a lot of ramifications, not just for social media companies, but thinking about policy at the federal and the state levels. Do we change the age restrictions? A lot of conversations around that happening as well.
Yeah, it'll be interesting to see what comes out of this. Dr. Courtney Blackwell, thank you so much for being with us.
Thank you.